Yes, we can hear you.
Yeah. So my name is Sonia and I'm from Empower School of Health. So today event we are organizing in collaboration with PHASOM, Pharmaceutical Society of Malawi. And as you can see on the slide, we have three speakers today. Ms. Tadala, she is a senior pharmaceutical supply chain management advisor, GHSC PSM Malawi. Professor Andy, he's a director training and capacity building Empower School of Health. Emmanuel, pharmacy assistant, Ministry of Health Malawi. And our moderator for today's session, Ms. Patience Khumani, she's a pharmacist, MASM Mediclix Malawi. Over to you, Patience. I would request you to please take the floor now. Thank you.
Thank you, Sonia. I would like to welcome you to today's webinar. Take note that at the end of this webinar, you will receive a certificate of participation. That is if you manage to complete up to the end. Okay, so let me introduce myself. I am Patience Komani. I'm working with Mazimed Clinics. I'm a pharmacist there. I'm also pursuing a course with Empower School of Health. And I'm currently doing my postgraduate diploma. I hold a Bachelor of Pharmacy from College of Medicine. And I'm the Vice Secretary for Pharmaceutical Society of Malawi. Yeah, that's all about me. Today's speakers. So before I go to today's speakers, I have to announce a few housekeeping for all the participants. Please mute your mic and turn off the video and ask questions using chat box, or you can raise your hand. There are two polls that we all need to participate. And you also have to adhere to the webinar schedule timings. Please mute your mic when the other speaker is speaking. Yeah, that's all. So let me introduce today's speakers. Sonia.
Yeah, Patience, there will be a poll 1 before introducing the speaker. If you can see on my screen, I hope you can see my screen right now.
I can't see your screen right now.
Yeah, so there will be a poll 1. I would request my backend team to please launch a poll, and I would request all participants to please participate in this poll. You just need to select the respective answers in front of the questions, and then later the summary of the results will be given by Patience. Thank you.
Sonia, please add Emmanuel. He's in the waiting room.
Yeah, he's already in.
Okay.
I would request all participants to please participate in this poll. I can see only 57% of participants have participated. So please select the respective answers in front of the questions. This is just a background poll that we would like to know you, a few information about you. So you just need to select the respective answers. Thank you. Patience, I believe Emmanuel is facing some problem while connecting. Please stop the polling from back in. Yeah, patients, if you can just go through with this summary of the result. Are you there? Ms. Khumani, can you hear me? No worries. So I'll just give you the brief summary about the results for this polling basically. So as you can see, what is your gender? So maximum number of participants are male today, 86%, and females are 14%. What is your age? So we have maximum percentage of 30 and above participants today, and between 30 to 40, 38%, and 40 to 50, 14%. Geographical region, we have maximum participants from Malawi, and then from West Africa, Central Africa, elsewhere. Academic background, we have maximum participants from pharmacy bachelor degree. We also have participants from non-pharmacy profile, others also, a pharmacy with PhD also. And how many years of experience? So maximum percentage is having more than 5 years of experience. Then between 6 to 10 years, we have 29% of participants, and 11 to 15 years, 19%. That's all for the polling. Now we will just move on to next slide. Patients, are you there? Can you hear me?
Yes, I was temporarily out. I was booted out. I'm now back.
Okay, so is your net is stable now? Can you introduce Emmanuel, and if Emmanuel has joined us?
All right. So one of our speakers today is Emmanuel Kabudula. Emmanuel Kabudula is a pharmacy assistant and a Pharmaceutical Society of Malawi member working with Ministry of Health of Malawi at Makwila Health Center. That's in Chikwawa. He's also a student of Empower School of Health, and he was awarded a scholarship for a 12-month online postgraduate diploma in global health procurement and supply chain management. He's going to be one of our speakers today. Sonia, next slide. So he'll be sharing his experience on online postgraduate diploma in global health procurement and supply chain management. Emmanuel. Hello.
Emmanuel needs to unmute.
Emmanuel, over to you. You need to unmute. Emmanuel.
Okay. Yes.
Okay. Can you hear me?
I'm hearing. Yes.
All right. I'm handing over the floor to you.
Thanks very much. Yeah, I joined the PHASOM when I was just finishing my studies. After recognizing that the PHASOM is the backbone of Malawi pharmacy, there at PHASOM, I benefited a lot. One of the benefits is I got full scholarship last year from Empower School of Health through PHASOM. So to my side, it was like a dream that I couldn't expect it. First of all, I thank God. I feel honored and respected with so much money that I have received from Empower School of Health. Doing such course has helped me a lot in my career as well as the country in general in the following areas. After this coming month, which is November, will be a qualified person with diploma in procurement and supply chain management. On this has shortened the gap that was there in the country due to the shortage of procurement and supply chain management staff. Knowledge and understanding gained will help the out of stock disease that the country is facing. in continuation with this course, I can encourage a lot of people around to pursue this. It is since excellent, easy, and it does not require someone to be pharmacy personnel, only to study it. That is, anyone can be free to study the course. Not only that, but human resources are essential in the procurement of drugs and commodities. That is having a lot of qualified staff who understand the language of procurement in terms of data availability, analysis, and interpretation and use. Most of this course, procurement and supply chain management, it focuses mostly on data availability, analysis, and interpretation. Therefore, we need a lot of qualified procurement and supply chain management. So with this Empower School of Health, we encourage a lot of people to participate, to take this course so that we can improve on our management. On partnership, I shall take time to thank PHASOM for working hand in hand with Empower School of Health, since it has made this course available, reachable, and accessible in Malawi. Great honor should go to the school trying their best to make ends meet by providing the necessary course to fill the gaps that are in supply chain management. PSM will be organized and voice out what is needed in procurement and trainings, as well as recommended staff being provided to procurement and supply chain management staff. Empower School of Health, I can praise the Empower School of Health. You have to continue your good job rendered to us. That a lot should benefit from you as well. As time goes, all the discrepancies will be corrected and working smoothly. With your course being available, I can assure a lot of people, a lot of Malawians, a lot of all around the world that procurement and supply chain management will be working smoothly, because there is a lot to be learned. We should not take it as a pharmacy personnel we learn at school about procurement, but this is different. This course, it covers a lot. Therefore, I can encourage a lot of people to pursue this course. But in summary, it's possible with Empower School of Health to have procurement certificate and boost our career, as well as helping the countries on drug and supply availability. With these few remarks, that's all I can share from here in Malawi, that Empower School of Health had helped a lot in my part, as well as they are helping others who are receiving special scholarship from Empower School of Health. Thank you.
Thank you so much, Mr. Emmanuel, for sharing your experience with Empower School of Health. Just a reminder, if you have questions, just drop them in the chat. Sonia?
Yeah, thanks.
Hi, Sonia.
Yeah, thanks. Hi, Patience. Yeah, thank you so much. Thank you, Emmanuel, for your feedback about the courses. And yes, as informed and quoted by Emmanuel, that the PGD helps him a lot in growing his career. And we still have we do have partial scholarships for other candidates also, so for which you can visit our website, you can fill up your application form, and then relevant team will get connected with you with the next process. So now I would like to briefly introduce Empower School of Health, what we do, what we are actually involved in. So it will give you a brief idea about ourselves. Empower School of Health, our capabilities: transforming the way learn, work, save lives through digital learning. We have a registered office in Geneva, New Delhi, Dakar, Nairobi, Kathmandu, Bangkok, New York, and Harare. Next slide. Yeah. So about Empower. Empower is a capacity building organization and has worked over 100 countries across multiple language to strengthen the institutional and HR capacity of global health and humanitarian programs through digital learning interventions. As you can see on the left hand side, our reach has already been reached out to 200,000 public health professionals globally, and the focus area where we actually work on this is leadership and change management, digital learning, public health, procurement, and supply chain. And on the bottom you can see the 5 domain areas that we actually worked on the right hand side. You can see our clients, our partners with whom we have worked on specific projects, or on we are closely working with them. This slide will give you a brief idea that through how long Empower has reached out to different institutions, universities, organizations. So PHASOM is one of our partner in Malawi, and as you can see over here, University of Zambia, Pharmaceutical Society, Zimbabwe, councils, Ministry of Health, National Pharmacy Council, Rwanda. So these all our partners, and few more has to be added on this slide, with whom we have recently get partnered with. So this is a brief information about it, that we work with government bodies, UN agencies, donor agencies, academia, professional association, and implementing organizations. This slide will give you an idea about our advisors and faculty member. Professor Paul Lalwani, he's a director Empower Group, former head of Global Fund, Procurement and Supply Chain Division. Dr. Danny Brown, Director Empower Swiss, former director. Then today's Professor Andy, he's one of the speakers also. Professor Andy is a director, training and capacity building. This slide will give you an idea. I mean, this has to be updated. There are more courses that has been added that will be explained to you by Professor Andy in his presentation. But this is for now is the courses that we offer. Recently, we have launched masters also. And masters is a 24-month course and 12-month course. Basically, we have 2 categories on it that will be explained to you on a later slide. So yes, as explained to you, we have 2 category under master's course, and master's course we have launched in collaboration with UNITA. 24-month course is applicable for all applicants, but 12-month course is specially designed and eligible for those who have completed PGD course with Empower School of Health. So for others, the master's course will be of 2 years, and those who have completed the PGD and have graduated from postgraduate diploma from Empower School of Health, the master's will be for 12 months, and the fee you can see on the slide. Also, the PGD course is a 12-month course, and the fee is mentioned over here. These are the original initial pricing. We have some partial scholarship, and that will reduce the fee. Please get connected with us in order to know about the fee structure. And process for applying, as mentioned, that you can either submit your application to PHASOM, or you can visit our website. That will be posted on the chat box by the backend team. You can visit the website, you can fill up the application form of the respective course that you are interested in, or either you can get connected with me on the email ID that is mentioned over here, which is operations@empowerschoolofhealth.org and info@empowerswiss.org for any query related to the course enrollment process. Then all application will be reviewed by the management committee of Empower School of Health and PHASOM, and the selected applicants will be informed about their partial scholarship, what amount they have to pay with the final fee, and what is the the process and installment plan. We also have installments plan in which you can pay as per your convenience. Now, I would request patients to please take a floor further and introduce Mr. Dala to speak on her presentation. Thank you so much.
All right, thank you so much, Sonia. I've seen a number of questions in the chat, but yeah, we'll ask those questions at the end. For now, let me introduce our next speaker, Mr. Dala Hamisi Mengezi. She is a senior pharmaceutical supply chain manager advisor at GHSC in Malawi. She's an experienced pharmacist with a demonstrated history of working in the hospital and healthcare industry, skilled in management, supervision, and training of pharmacy staff, pharmacy practice, supplier, evaluation, and procurement and medicines registration. She holds a Master of Health Sciences in Antibiotic Stewardship and Conservation from the University of KwaZulu-Natal, South Africa, and a Bachelor of Pharmacy honors degree from Malawi College of Medicine. Mr. Dala Hamisi, over to you. I'm handing over the floor to you. Thank you.
Thank you, Patience, and good morning, good afternoon to you all. It's a pleasure to be able to speak, to be one of the speakers today, and I look forward to a conversation with you. It's more of a conversation more than me teaching anyone, since we're all experienced pharmacy personnel here. Next slide, please. So just to give a brief background about myself, in addition to what Patience shared, previous slide. So I'm a pharmacist with over 10 years of experience, and I have worked in the hospital setting. In my previous setting, I was also working as a supply chain management team lead at Department of HIV and AIDS, Ministry of Health, where I had the opportunity to work alongside the Global Fund team, who are the main sponsors, donors for pharmaceutical supply management in Malawi for HIV and AIDS response. I'm now currently working at Global Supply Chain. However, for this presentation, I'm speaking as myself, a pharmacist from Malawi. So for our colleagues who don't know much about Malawi, we just wanted to share a brief background of the health supply chain in Malawi. The Ministry of Health Malawi provides governance for all supply chain issues in the country, and Pharmacy Medicines Regulatory Authority is the one that is the regulatory authority which is supporting Ministry of Health in terms of governing the country. In terms of warehousing, central warehousing and procurement, we have Central Medical Stores Trust. Its main office is in the central region of Malawi, Lilongwe, with some offices in the northern and southern region of the country. They do procurement and distribution for the public sector in the country. At Ministry of Health, there are disease programs which are mostly funded by donors, namely Global Fund and US government. These disease programs include TB, HIV, malaria, extended immunization program, EPI. So these programs are the ones that are able to do supply chain management for most of the commodities in the country that are donor funded. But they work hand in hand with both private and public sector, since the commodities that are provided are sent to both public and private sector. In terms of the private sector, we do have retail pharmacy industry. We have manufacturers that are able to manufacture some of the products that we're using in the country. And in terms of the NGO sector, we have our donors that are aiding the country in terms of supply chain response. Next slide. So I was asked to highlight some of the gaps we have in terms of the supply chain in Malawi, and I thought I would also highlight the opportunities that we have, although we have these gaps. I think what COVID has taught us is that it would be great if Malawi was to expand in terms of manufacturing. We are high importers of most of our commodities, and during COVID-19, we've had supply chain challenges in terms of shipping most of our commodities in country, whether it was Forex issues or just freight challenges due to the pandemic that has been caused globally. We've also noted that we have some inadequate QA and QC testing in private sector before most of our commodities are released on the in terms of before they're sold to the public. So the opportunity we have here is that the Pharmacy Medicines Regulatory Authority had enacted the Act of 2019. Previously, the Act was of 1989 and it was very outdated. Therefore, the PMRA was unable to institute most of its mandate in the country, but through the Act, we're able to expand and scale up QA and QC in both public and private sector, as well as governing of all supply chain personnel in the country. One of our main challenges as well is an inadequate drug budget in the public sector. This is causing challenges in terms of persistent stockouts on the market. However, through PHASOM and other governing bodies, we're able to speak up and to work with Ministry of Health and Treasury to at least try and obtain a higher percentage of the budget so that we can at least increase commodity access to the population in the country. We have also recently had improved HR capacity in both public and private sector. Just to give you perspective, I finished school in 2010 and I was only in the second group of pharmacists to graduate in Malawi through Malawi College of Medicine. However, over the years, we've managed to expand the cadres that we are training, both pharmacists and pharmacy technicians, as well as assistants, through our two institutions that are training the pharmacy personnel in the country. Through this, we've managed to at least start engaging other countries as well as within Malawi and improving the supply chain of the country. Next slide. I think this sort of summarizes the gaps and opportunities that we have in terms of Malawi's supply chain. As I previously mentioned, most of the disease programs are funded through Global Fund and US government as well as other partners. So this has over time created parallel supply chain systems. However, Ministry of Health has managed to start integration of the parallel supply chain alongside all of our donors, and we're starting to see improvements in terms of supply chain in the country. Just for example, at some point, if you're at a facility, one of over almost 800 facilities in the country, you could receive supplies from 4 different trucks in a month. Let's say malaria delivers, then HIV, essential medicines. But now we're starting to integrate the supply chain with some of the commodities being delivered at the same time using the same resources that are available currently. We've also faced some infrastructure challenges at Central Medical Stores Trust with limited warehousing capacity, which is the other reason that there was parallel supply chain systems introduced. Moving forward, we're looking at expanding the warehousing capacity through Central Medical Stores Trust as well as distribution capacity. We have several EMR systems at our facilities, starting with CStock at the community level, EHIN, as well as Open LMIS in most of the facilities. This has increased the workload for our pharmacy personnel in all the different facilities. So just actually 2 weeks ago, Ministry of Health has managed to launch the supply chain systems architecture, which is a plan which is going to assist the country to see how best to integrate the different supply chain systems in terms of usage of an interoperability layer where the different systems are able to communicate with each other as stage 1 of the integration of the end-to-end visibility. We also have noticed some limited visibility of supply chain from central level. What this means is, as much as we're collecting data on the ground, we have not had adequate time and expertise to create dashboards for central level team as well as district teams to be able to view integrated data, populated data, to see exactly what is going on in the district as well as in the country. The Ministry of Health has also managed to successfully launch the Master Supply Chain Transformation Plan, which also takes into account some of the challenges that are being faced. And it's also going to assist in end-to-end visibility through GS1 standards, as well as the interoperability layer that was mentioned in the supply chain systems architecture, which happens to be part of the Master Supply Chain Transformation Plan. Next slide. So finally, in terms of career path for pharmacy personnel in the country, usually after you're trained at one of the two colleges that do training in pharmacy personnel, one of the three actually, we've recently expanded. There's an internship program for pharmacists to attend for 2,000 hours, which takes place in 1 year. So currently the pharmacists are able to be allocated to the central hospitals in the country. And for wholesale, we're using Central Medical Stores Trust as wholesale experience for the pharmacists. Industry, some of the manufacturers have been able to embrace the internship program and to allow pharmacy personnel to do internship in their outlets. Some retail pharmacies are also able to train pharmacists during the internship and orient them on how retail pharmacy manages in terms of private sector business. After that, the pharmacists are supposed to take the Pharmacy Medicines Regulatory Authority Malawi Pharmacist Professional Qualifying Examination. After passing the exam, they then attain their career choice, whether it's in the public sector or in the private sector. However, whichever direction you take in terms of a supply chain personnel, some key areas that could assist in terms of improving the supply chain system by using HRH component is considering postgraduate studies. For example, how Emmanuel is studying with Empower Health Sciences. This is greatly improving the supply chain in the system because previously we were not trained very adequately in terms of health supply chain at the colleges. But with these postgraduate studies that we're able to attain now, we've seen a lot of improvement in terms of the knowledge that is attained by our pharmacy personnel in the country. There are also a lot of online resources that are available through reading. I believe that we can use these resources to further attain better standards in terms of supply chain. And I remember I attended a meeting where the CEO of Central Medical Stores previous, not the current one, had said the meeting starts when it ends, because he was trying to say through informal discussions, that's when you're able to learn more in terms of what other people are doing. And, you know, these are highly encouraged. If you go to a meeting during the break time, you're able to at least learn one or two things in terms of what is really going on in the other industries that you're not currently attaining in terms of career. CPD, as we're currently doing right now, very important factor and for pharmacy personnel. But we also believe if we're to establish a mentorship program through PHASOM, this could really help with the pharmacists that are just starting up from college and they're trying to figure out and find their feet. Where do I belong? Because usually there are a lot of choices and you're not sure if you want to go to industry or retail or perhaps stay in the public sector. Through these mentorship programs, we could really assist further training of pharmacy personnel and further mentorship to see how best they fit in terms of the Malawi supply chain. And of course, if we continue, there are some studies that have been done in antimicrobial resistance that a team is doing with the central team at the Chisu lab. If we continue in terms of collaborating on studies and publishing, students will be able to read and to further collaborate more with us in the future and to improve the supply chain of Malawi. I will end here and thank you very much for listening. Thank you. Back to you, Patience.
Thank you so much, Mr. Dalla, for the insightful presentation. Just a reminder, please drop your questions in the chat. We'll have a Q&A session. Okay, so let me introduce you our last speaker for today. Sonia? Okay, thank you. I couldn't see the screen. Our last speaker today is Prof. Ande. He's a global public health expert, and he's a professor of public health and director of training at the Empower School of Health. He's one of the co-authors of the Yellow Book. I'm sure most of us have come across it. We've read it during our undergraduate, Managing Drug Supplies by MSH and World Health Organization, and the e-handbook of the Healthy Systems in Action. He has over 30 years of experience of working with major international funding institutions, bilateral donors, and the private sector in low and mid-income countries. The main focus of previous experience includes effective management of pharmaceuticals, vaccines, and medical commodities, and especially the implementation of programs for the introduction of new medicines and rapid diagnostic for neglected tropical diseases. He has undertaken donor-funded activities in over 40 countries, from provision of family planning commodities and the responses to the early onset of HIV in the 1990s, through the Global Fund grants in the 2000s, essential medicine provision in conflict zones, and extensive training in the quality of medicines. Most recently, he has authored the Empower School of Health Data Analytics course. Prof. Ande, over to you.
Greetings, good morning, good afternoon, good evening, wherever you are in the world. I see we're spanning the world with our participants today. Okay, next slide, please. Okay, so we're going to talk about career developments in a general sense, and I particularly want to talk about the impact and importance of data and data analytics and how that affects career development. Next slide, please. Well, in the public health supply chain, we've got lots of problems. None of our systems are working that well. And if we ask what is the problem, well, of course, there's lots of problems, all different issues, but always number one problem that comes up is data. We don't have data. Even when we do have data, it's not reliable. And again, even when we have it, we can't use it very much. We don't have the skill sets, we don't have the wherewithal to apply data. So while there's lots of problems, all the agencies have a consensus and agree. You can see the different links from different agencies on the screen, all about data. We don't have adequate data in the public sector. And that's a surprise because the private sector does have lots of data. They have it available and they use it. If I just ask a simple question, what's the value of your stock in the central warehouse? I doubt that there is one country in 50 that can answer that. But every private sector operator will know to 3 decimal points what their warehouse value is. We don't have the data. Well, the obvious question to ask is, why don't we have the data? Next slide, please. And again, there's lots of reasons why we don't have data. But again, the consensus among all the different agencies in both public and private sector is we don't have data because we don't have sufficient skills to use data. We don't have competence in data management and especially in data analytics, so that we don't value data. We're not collecting data, we're not processing it because we don't have an adequate range of skill sets. Well, is that really true? Do you really not know about data and how to handle data? Global Fund says you don't. Most public health organizations say you don't, and the private sector says they don't have enough people. Next slide, please. Well, let me ask you, on the screen here is a simple formula for exponential smoothing of average monthly consumption, AMC. I'm sure you're all familiar with the term AMC, average monthly consumption, and there's the formula. How many of you can operate that formula? And that's a simple processing of average monthly consumption to give us an exponential smoothing. Most of us just take an average. We just 3 months usage, divide by 3, that's the average monthly usage. There are much better ways to process that data. But often we find that supply chain staff don't have the skill sets to be able to operate equations and functions like this, or feel comfortable with equations like this and the algebra and the calculations. It's not there. Next slide, please. So then we ask, why don't you have these data skills? Well, in the beginning, if we start, it's because they don't teach this at pharmacy or nursing or medicine school, unless you happen to be in Vietnam, where it's compulsory for all pharmacy degrees to undertake this. And if you did a management degree, even an MBA, they don't teach it in management school either. So you are not going to get this in your undergraduate education. It's not going to happen. It's not there. Perhaps if you did medical epidemiology, maybe you would get that kind of advanced analytics, but otherwise, no. In a normal pharmacy course, in a normal management course, you don't get that kind of data management and data analytics. So we don't normally have those skill sets available to us. Next slide, please. Well, why don't you have the skill sets already? We saw from the poll, most of you have been more than 5 years in the profession. Surely by now you've developed those skill sets. You know how to analyze data and you know how to manage data. Well, if we look at the public sector, we find there's very weak incentives for anyone to learn those skills, to take those skills on and to manage them. Generally, data is not regarded as great value in the public sector. Right from the minister, the political side, all the way through the secretariat, down to the technical level, it's just not considered, oh, the private sector does that, not us. We don't need all that data. We've been managing the system for 20 years without this data. We can carry on managing it. Well, no, you can't. And in the private sector, they don't believe it's their job to train anybody. They want people they can hire who are already trained, but they're not trained. And as you can see, they can't find people who are trained in data analytics for supply chain. So both sectors have a major problem to get people. Public sector doesn't incentivize, private sector doesn't train. Next slide, please. And we see this critical statement from supply chain management: failure to use data analytics is preventing the supply chain from improving. Frankly, we are never going to get a lot better if we don't start using data. But to be able to use data, we have to value it, we have to know how to manage it, and we have to be able to analyze it and make sense of it. And that skill set is still largely missing from many of our public sector supply chains, and frankly, in quite a lot of the private sector supply chains as well. Recognize, if we don't embrace data, if we don't look at data analytics, we are not going to improve massively. We're always going to be locked down in perpetual stockouts, in never having enough funding, in never making the system work. Next slide, please. The major donors have already recognized the value of data analytics. We have a major report from World Bank and PEPFAR, probably the most successful, massive supply program of medicines in the world. They embraced data analytics from the start. They forced countries into reporting. They forced software onto countries to make them report to the ARVs, to make them all data tracking throughout the whole process. And the success of that program showed it was massively funded, but also it had data analytics from the very start. It collected and analyzed the data and gave feedbacks on what is happening, why is it happening, and what can we do to manage the future. So we got data for what is happening. We had predictive data for the future. The donors are on board in driving data management and data analytics. Next slide, please. Well, how do you measure your supply chain skill sets? I gave you one equation, but that's really just a spot look. And people that deliver, in conjunction with Empower School of Health, have put together a competency framework for health supply chain management staff. And you can use the framework and you can measure yourself, self-assess. Where do you think you're strong? Where do you think you're weak in your skill sets? And that helps you understand your own particular competence. And that's important as we look to the future, because we're not looking at general supply chain. We're looking at particular areas that people want to develop their competency and their skill sets. And you can measure your competency and skill sets using this framework. Next slide, please. And the Empower School of Health uses the same one, except you get a pretty radar graph with ours. Okay, so you can see on the graph the radar plot where you can see build and maintain supplier relationships. Well, that's perhaps okay, it's in the middle ground, whereas other areas are very low. Supply planning is just at 40%. So that's your individual skill profile. Then you can look at that and say, well, I'm pretty good on warehousing. I'm not so good on procurement. Perhaps I need to improve my procurement skills, and everybody needs to improve their data management and data analytics skills all across the board. Point about this is we get away from generalized saying you must improve supply chain into specific competency areas, skill competences. Where do you need to strengthen your skills? You might not be interested in procurement. You might be very happy in warehouse work. That's fine. This helps you plot out where you're going, where you want to be in the future. Next slide, please. Well, that's okay, but when you've plotted out where you want to go, how do you gain these competencies? Here we have to have a major shift. We look at the latest Global Fund supply chain roadmaps and supply chain reports. They are saying top priority is data systems, but they must be systemizing capabilities. Big word, but what does it actually mean, this systemizing capabilities? It means you can't just parachute people in for a 2-week course and expect everyone to know all about supply chain. It's got to be part of your normal operation. Supply chain will include continuous training, continuous professional development, always going on with new areas, training new staff all the time in country, not going outside to do an MSc and then never returning to your home country. In country, on the job, as part of the operation. It's built into what you do. So in addition to physical supplies, you are undertaking training throughout the whole program all the time, systemizing competency and capacity development. And we see here, what advice do you have for supply chain leaders? Skills development. So for the private sector as well, if they don't invest in skills development, they're not going to have the staff that are needed for data analytics to drive their supply chains either. It's across the board. In public and private sector, we have to get away from skill development being an outside function to being part of our normal operation. It's what we do all the time. Train people and continuous professional development. Next slide, please. Well, what does this mean? It's back one, please. Yeah. Good. What does this mean? It means we're going to have a massive capacity development in public health supply chain. It's got to be institutionalized. That means it's part of your normal operation to train people. It's got to be relevant for public health. Learning about the British Constitution or how to order railway sleepers and rail lines is not specific for public health. It's got to be relevant for low and middle income countries. The way we do things in low and middle income countries is significantly different from the high income countries. And we need programs that focus on what we need in the LMIC. It's got to be accessible, and these days that really means online learning. It's got to be available to existing and to future staff, and it's got to be appropriate for senior staff. We can't take senior staff and do talk and chalk in classrooms. We need mentoring, on-the-job training and development. Problem with all this is that the donors are not promising to fund this. They're saying, every report says, you need to do this. But they're looking at exit strategies. They're looking at getting out of donor funding, which means it's going to be on the country to start supporting this. One reason the donors are not funding this is because you are not asking for it. If I look at the Global Fund grants for the last 10 years, all the countries in the world that receive a Global Fund grant, only one has ever asked for supply chain training as part of their Global Fund grant. If you think supply chain training is important, you have to ask for it. We as a university can't ask for it. That's conflict of interest. It would be like you asking the manufacturers for free medicines. It's not going to happen. The donors might fund medicine for you, and they might fund capacity development if they are asked. But countries, people are not asking for it. We're trying to develop scholarships, but to do that, we need donor support as well. And that means that you, as an individual, as an organization, as a country, need to ask. Every grant application should include logistics capacity development. It's a key point. Okay, next slide, please. I have to emphasize as well, there's a need for quality procurement supply management training. The report from Partners That Deliver says there's just not enough high quality courses available. I regret many of the courses are just not appropriate for low and middle income countries. They're not adult learning courses. They're like classroom chalk and talk courses. They're generic. They're not adapted to your circumstances. And they're not linked to the actual job functions. Capacity development must be linked to specific skills development. What skills do you want to develop? That's how the course has to be structured. That's how it has to be programmed and developed throughout. Next slide, please. So online learning is not just a few slides on the internet. Lots of people have tried to do that, particularly during this COVID period. They've taken the slide set they used to present in a classroom and put it on the internet and said that's online learning. It's not, and it never can be. Online learning uses blended learning techniques. Yes, of course, there is web-based learning, but there's also micro-learning, virtual labs where you can do what-ifs. What if I did that? What would happen? The adaptive assessments, where you look at assessing yourself, see where you might want to improve, and gamification. Yeah, as an old man, I had to learn that playing games actually can help you learn. It can. And we use that as well as part of the system. So not just a few slides on the internet, a full internet learning program. Next slide, please. Okay, Empower's recently launched the Master of Science degree in Global Health, Procurement and Supply Chain Management. It's a 24-month program. If you've already completed the postgraduate diploma, it's an extra 12 months program. It's a long course. You can do it on the job. You can do it while you're still working. It's intense. It's difficult. You're going to learn a lot. And even that won't give you full data analytics. It will give you the good grounding, a good start. but you'll need to build more on it. It's a good course. It covers the whole range of procurement supply management. And because it's linked with UNITA, you can be sure you've got the United Nations backing. It's a real recognized degree. Next slide, please. We also provide lots of training webinars, most of which are free, online. You can follow those on. Look out for the ones especially on data analytics and data management to try and build up your skills. But it's a big area. You can't learn it all in a 1-hour webinar. It would take a 1-year program to do. Next slide, please. Empower has lots of courses. There's some 2-month courses, some short courses. Look at your old skill sets. Look at the particular areas where you might want to develop. Perhaps you say, I'm not so interested in procurement, but I do want to look at leadership. Look at that course. Look at other functions across. I don't want to look at improving quantification. Look at that course. Next slide, please, because there's even more courses available. They're all on the Empower website. You can follow them through, take them along. So my summary message is that public health supply chain needs staff that understand the value and can utilize data. And that means having the skill sets for data management and data analytics. Public health supply chain will never improve, and that's a strong thing to say, but I believe it will never improve, and it may well collapse if we fail to embrace effective data management and new analytical techniques. These data management skills are not part of normal undergraduate courses in either health-related, such as pharmacy, or in management-related topics. Training and skills is available in the critical areas, but funding support is not being requested. If you need support for this, you have to ask for it. Okay, a lot from me. I'll stop now and move on to Q&A.
Thank you, Professor Andy. Patience. Can you take the floor back?
Hi. I hope you've dropped all the questions you wanted to drop in the chat.
It's there already. Okay.
All right. Okay,
I can see the recent question that by Yoki. What are the 3 types of supply chain strategy, supply chain management system, supply chain, and logistics?
Well, I'm happy to start just to move that while we're waiting for other questions to come in. I think that the strategy from me, the 3 strategies are data, data, and data. And I know that sounds a little bit strange, but number 1 problem we have is not using data. And when we correct that, some of the other issues will also reduce. But there are many supply chain strategies. Fundamentally among them, we have to improve data use. We have a question, how much does it cost for a diploma course? All the fees are on the website. Please take a moment, look at the website, look at the different conditions. It depends a little bit on which country you're in on the fee levels.
Prof, there is a question, how can we use AMC towards forecast?
Well, AMC is the absolute key of forecasting. This is average monthly consumption. If I want to know how much I'm going to use in the future, I have to start by knowing how much I've used in the past. And that is my average monthly consumption. That's my baseline. What did I use in the past? Then I can look at what I'm going to use in the future. And there are around 4 different approaches to forecasting the future. The best approaches all use predictive data. And to do that, I have to collect that data. How often were you out of stock? How long were you out of stock for? That's a correction factor that has to be applied. What's the expansion of the program? That's a factor which has to be applied. So data analytics can assist, but always you're going to need inputs. So we talk about a committee of the great and the good on forecasting who put together the different factors, who estimate expansion or reduction in the program, who look at the future and say, well, we're going to phase out this particular antiviral medicine. We're going to phase in another one in the next 6 months. So let's look at that. Lots of issues to involve, but it starts by knowing what you've used in the past, and that's the average monthly consumption.
Thank you, Prof. There is one question. Is possible to pay per module slowly until somebody finishes all modules for program enrolled for? So for this question, I would like to answer. See, we do not have per module payment plan, but yes, we have an installment plan. The entire fee, the final fee can be paid in 3 to 4 installments. For that, you can get connected with us on the email ID that is mentioned on the chat, or you can fill up the application form.
There's another question from Tikale now. How do people get chances of getting a scholarship?
I think for you, Sonia.
Yeah, so in order to get the scholarship and to know about the scholarship that we offer, I would request again to fill up the application form and the respective team will get connected with you. Generally, we have a partial scholarship that has been awarded to you. There is a write-up that will be asked from you to write on it. And based on that, the scholarship will be provided to you. So please get connected us on the website or on the email ID that is mentioned on the chat.
In addition to that, for those that are in Malawi or PHASOM members, you can just contact us. We'll help you to get that scholarship for PHASOM members, that is, so those that want to be PHASOM members, those from Malawi. Thank you so much.
If any other question anybody would like to ask, they can raise their hands and we will unmute them themselves so they can speak on the respective questions, or they can put the question on the chat box.
Okay, we have one question there. What is the importance of this data analytics in supply chain management? I think I have missed it in the presentation. Okay. If you don't have data, how can you possibly manage the system? If you don't know what's in the warehouse, if you don't know what stock you have, how can you manage anything? If you don't know what's being moved through the system, what's at each level of the system, what's being provided, how much you are using, and how much to order in the future, you're always guessing. You don't know, you're just guessing what it is. Data management and data analytics is managing that data. Where is everything? How much does it cost? Where is it going? How much are we using? What is the trend? Data analytics, above all, gives you the trend. We have increasing use of this. We have decreasing use of that. In the future, I need to order more. In the future, I need to order less. If I have a big row of figures, it's very hard to tell what's increasing and what's decreasing. If I have data analytics, I can see a clear graph, a clear visual plot, a dashboard of where I am going. Then I can make informed decisions. Often we don't have enough funding. And I will say in the near future, we're not likely to have enough funding. So we must take decisions about what we buy and what we can't afford to buy. Because we can never buy anything. Even in the high-income countries, they can't buy everything. To take those informed decisions, I need data analytics. I need to know how much I'm using and what's it costing me. Why am I spending so much money on cough syrup when it has little therapeutic benefit? Data analytics will tell me how much I'm spending, where it's going, and I can then analyze the figure and say I'm better off buying life-saving medicines than these formulations which are expensive and don't have much therapeutic benefit. All of that section comes under data analytics.
Prof, I can see there are two to three more questions. If you can answer them as well.
Right, okay, let's have a look. How can supply chain management, oh, okay. Right, okay. A session on forecasting. Okay, a session on forecasting would take about 20 hours. So it's not something you can do in a 1-hour webinar. It really is complicated. You really have to take the whole module, and in the course we run a whole module around 20 hours, and that's the basics of forecasting. The original WHO forecasting course was 6 weeks, and that was just for ARVs. For all essential medicines, 20 hours is really the minimum you can do to understand about forecasting. So a 1-hour webinar on forecasting is not that helpful. We can do it. We do it as a summary, as part of the module in the Empower courses, but that's only a summary of the information. It really is complex. You really have to go through it in detail. How can supply chain integrated with the pharmacy program or any other health related program? It already is. Private sector is doing it. PEPFAR does it. Most of the UK National Health Service does it. German and French Health Service does it already. They have data analytics in place because they understand the cost saving and the benefits that it brings. So yes, it is possible, but you can't integrate it fully into a pharmacy course. It's around a 1-year course for full data analytics. You can't add that in to a 3-year pharmacy degree. It's got to be a separate course. We can do a touch, we can introduce it, as Vietnam has done, into the pharmacy undergraduate program, but only the message of how important it is and what value it is. Did I miss any questions? Do we have any more? And
Yes, Prof, there is a question by Ahmed. What is the qualitative and quantitative data analytics in supply chain management?
okay, we'll take quantitative first. I measure it, I process the data. Okay, and that then gives me, I turn data into information. That's the fundamental of data analytics. The qualitative is, what does that mean? Always the science must be linked with the arts, if you will, and that's the qualitative side. What does that mean? How does it impact? How do I undertake balance? So all the time, everything we do needs to be a balance. I can never buy all the medicine I need. How do I make a balance? I use the data and data analytics to give me the science, and I use the arts to make judgment decisions. That's the qualitative aspect of it. How can data analytics be applied in a manual system? With a lot of calculation, I think is the answer. It's difficult. You can do it. We used to do it in the past using 13-column Kalamazoo pads and calculators, but it's difficult to do. It's problematical. But you can start to introduce it perhaps for a few critical medicines and then try and computerize and expand from there. Not even, go ahead, Sonia.
Yeah, there is another question. The last question, we'll be taking it. Migration of skilled supply chain staff in public sector to a partner NGO to take up supply chain function is a challenge. What strategy would you suggest to retain quality supply chain HR in public sector?
Well, we have to improve. We have to improve all the conditions in the public health, human resources supply chain sector, from base salary all through all the conditions. It's not enough just to improve the salary. It does need improving, but we need to improve all the conditions of service and make those much better and give the recognition of the profession of supply chain. People will recognize the profession of pharmacy. Somehow we're still fighting to get recognition of the profession of supply chain, but professional recognition and improve conditions throughout. Always we're in competition with the private sector, but we could retain staff if we have good conditions of service. And that's a key point.
Sonia, just to add to what Prof. Andy has said, we're definitely experiencing the same problem in Malawi, where we're seeing an exit of pharmacy personnel from the public sector. I suppose I'm a great example, but I think from experience, one of the key things that could keep somebody in government is career progression. Where do you see your career in terms of 5 years from now? How many job creation in terms of the organogram of the Ministry of Health? How much further can you excel as a pharmacist compared to another medical personnel? We're facing these challenges in Malawi, and we continue to try and improve them because the current organogram is a bit limiting for pharmacy personnel. But additionally, incentivizing, he already said that the base salary needs to be improved. But from what I've seen, if we do have these courses like these scholarships, which Emmanuel is attaining, this does help to keep people in the public sector. I will give another example. Prof. Andy did mention that there's very limited proposals for training in supply chain through Global Fund grants. That is true. However, some 4 years ago through the Global Fund grant, HIV grant, we did reprogramming of funds and managed to take about 10 pharmacists to Strathmore Business School for a training in supply chain just for 2 weeks. But you can tell after such trainings that people are very highly motivated to stay in government, and you're able to retain them due to this continuous method of engaging them thoroughly, rather than just allowing them to work without really giving them a thank you back training or anything of that sort. Thank you.
Are there any more questions in the chat? Sonia?
Yes, Patience, there's one from
Yeah,
Ahmed.
there is one question. Would you be obliged to reference pharmaceutical procurement and supply chain?
I don't really understand what that means.
Ahmed, I'm just
Oh,
asking
books.
you
Okay,
to.
books, right. Okay. He just typed in books. Yes, okay. Well, you can start with managing drug supply, MSD, the yellow book. That's available for free. You can download, although it's a big download, in PDF from the internet. And there's also the e-health manager's handbook with chapter 7 on procurement and supply chain management. There's the JSI logistics management handbook. You can find all of these easily available on the internet. And you'll see references on the screen of all the ones that I've quoted. A 2-minute Google search will find them all. You'll get the latest links for them. Managing Drug Supply by MSH, MDS free, will get you the download straight away. I'm reluctant to give links because now I'm afraid WHO and the other agencies, the links are out of date within 2 hours. It's almost impossible to keep a URL link up to date. They're changing the websites at WHO, World Bank, UN agencies by the hour. So it's better that you do a Google search to find them. Okay, Sonia, I think we can have the final poll. And
Yes, it's time to launch the final poll, and also we have put the webinar link, sorry, the certificate link on the chat box. So all the participants can download their certificate. But before that, do not forget to participate in poll 2. I would request the packing team to please launch the poll second. The poll 2 has been launched. I would request all to please select the respective answer. This is the last poll, and after that there will be closing from PHASOM and from Empower side. Before that, please do not, you need to select the respective answer. It will be only for a minute, and then we will share the results. This poll will help us to improve in the next sessions that we'll be organizing with PHASOM. With PHASOM, this is our fourth webinar that we have organized together, and there will be more coming in coming months. So this poll will help us to improve in our webinar planning and organizing it. So your feedback is really important for us. So please put all the answers in front of the question that is mentioned, and then later on we will share the results. I can see only 39% have participated till now. I would request all 100% to please participate in this poll. This is the last poll. The first question is, what percentage of information was new to you? I can see majorly it is between 50 to 75%, but still people are there voting. So we will see the final results. The second question is, after this webinar, would you like to enroll for our courses? I can see 72% yes. So please get connected with us. So we will let you know how to enroll to the course and but what best course you can enroll yourself. How did this session compare to your expectation? Excellent. Thank you so much for your feedback. The link for downloading your certificate is again pasted on the chat box. Please download your certificate. And if you are facing any problem, please put it on the chat box so we will solve it right away. How likely are you recommend this session to a colleague? I can see for 8 to 10%, 90% mention between 8 to 10.
I hope you've all seen the link that Sania has sent in the chat.
I think we should end the poll now. I would request back-end team to please stop the poll and share the results. Patients, can you summarize the results of this poll, please?
Can you hear me?
Yeah, now I can hear you. Yeah, patients, go ahead. I can hear you.
My net is tripping this side. Can you share?
Yeah, that's okay. I'll take it. So the first question is, what percentage of information was new to you? It's between maximum is towards 50 to 75%. Second question, after this webinar, would you like to enroll to the courses that we offer in collaboration with PHASOM? So 78% says yes. How did this session compares to your expectation? 66% says excellent, 31 says good, and 3% says fair. How likely are you recommend the session to a colleague? I can see maximum is towards between 8 to 10. Thank you so much for your feedback. Now, this is the closing remarks from Empower. I would really appreciate all the participants for their timing, for their presence, and I hope this session is useful for you, and we will be having more sessions like this, and that you can see on our social media platform, and that will be communicated to you. Special thanks to all speakers, um, Patience for your moderation, and William for all your support. Over to you, William. Few words from your side as well. Thank you.
Thank you so much, Sonia, our participants, and our speakers. Would like to express our gratitude to everyone who participated and made this possible, not forgetting the technical team. For our members and those who would like to become members or to do this course, the contacts are in the chat box, both for Empower and for PHASOM. Apologies to those that had technical challenges in joining this meeting. Next time we'll continue to do better and to improve. Looking forward for the next webinar. Thank you all.
Thank you, William. Please do not forget to download your certificate. The presentation will be shared with all for your future references. Patience, your closing remarks, and then we will close the session. Thank you all for your support. And if anybody faces any issue while downloading the certificate, please get connected with us on the email ID that is mentioned on the chat box. Thank you.
Thank you so much, Sonia. Once again, let me take this opportunity to thank all the speakers for the insightful presentations. We've learned a lot. And also let me thank all our participants. I hope you've learned a lot of things. For any queries, any questions, PHASOM is available, and Empower School of Health is also available. Please contact Sonia. And here in Malawi, please contact Mr. William Pute. I'm sure he has sent his email address in the chat. But thank you so much for your time.